There are multiple risk factors for the development of breast cancer. The most common risk factor is aging, and certainly that isn't a risk factor that is within our control. There's no way to prevent growing older, but that's the primary risk factor for breast cancer. Also, your family history is a risk factor for breast cancer, and not only if there's breast cancer or ovarian cancer in the family, but sometimes other cancers track in families that have higher risk for breast cancer. And I would say that although you can't control your genetics or your family history, you certainly can control knowing about your family history and having as accurate information about individuals in the family affected with cancer, so that you are proactive and can go forward and give appropriate information to your primary care physician or care team. Another risk factor for breast cancer is lifetime estrogen exposure, and this comes in a variety of flavors. It's when you started your period, when you went through menopause, how many times that was interrupted with a pregnancy, whether you use certain kind of birth control pills, whether you used hormone replacement therapy. And some of our hormonal exposure is controllable. We have choices about types of birth control methods that we use. We have choices about whether hormone replacement therapy is a good option for us. Another risk factor is your lifestyle and nutrition, and there's evolving evidence that the food we put in our body is very, very important about a multitude of medical issues, cancer being among them. And certainly this is a factor that we have ultimate control over, what types of things we choose to eat, and how we choose to acquire these. And a nutrient-dense diet that is low in sugar and low in refined carbohydrates is probably overall one of the healthiest diets for women to participate in, and would just engender good health overall, and probably would be a factor in controlling some of the risks about breast cancer. There's other risk factors out there, alcohol ingestion, cigarette smoking, whether you've endured an abortion or not, that I think are somewhat softer risk factors. But again, those are, factors that are within our control, and we have choices to make. And then exercise and lifestyle, again, is well within our control. And not only for cancer prevention, but just overall health, and for mental agility, it is recommended to keep moving and to do some level of aerobic exercise. Walking is a great and cheap exercise, as is just some stretching, light weights. These are things that all can be done at home, close to home, with friends, or on your own.